There is a pay dispute between doctors in the province of Ontario and, of course, the province of Ontario itself that pays those bills. And it's going to be very instructive to what happens across Canada under the financial pressures that Ontario is suffering. So joining us to discuss this, Christina Blizzard writes for the Toronto Sun, and she's at Queen's Park because I think the interesting part of this discussion is that the Ministry of Health is now run by two doctors. They know how things work. Dr. Hoskins and Bell, they're taking on the Ontario Medical Association. Give me this story.
Well, it's very interesting. Of course, this province is $12.5 billion, has a $12.5 billion deficit. It's facing down a $300 billion debt. So it has said that it's going to hold the line on all public sector pay, salaries, whatever. And so now, obviously, the doctors are in negotiations, and the doctors have done very well under the Liberal government. They've had some very significant pay hikes over the years, and now we heard from Eric Hoskins, Dr. Eric Hoskins, as you said, Pat, the new health minister, last week when he was talking about holding the line. The OMA talks have broken down between the Ontario Medical Association and the government's negotiating team. He was talking about, how many the physician services now are 25% of the provincial health budget and 10% of the overall budget.
Wow, incredible. And so I guess to address that, they're talking about pay cuts for doctors. The number that I saw bandied about was 2.65% decline in what they get paid, and they're going to lose their weekend premiums, right?
Yes, some of the little pay and perks of that they were paying some parts of education of doctors and other perks are being scaled back. And the doctors naturally are complaining about that. Now, they struck a deal. The last deal they struck in 2012 was supposed to produce, I think, $200 million in savings. And the doctors themselves were supposed to be the ones who were going to help find those savings. Unfortunately, they didn't materialize because the doctors simply started seeing more patients. And so the bill is not going down. I mean, Hoskins was talking about how there are 400 doctors in this province who make more than $1 million. Now, that is a little misleading because, of course, it includes overhead. Government doctors have to pay for overheads out of all that. So some of them are in clinics, or they're in areas of certain disciplines of medicine, such as cardiac surgery, for example, in underserviced areas, maybe getting more. But certainly these are very significant numbers.
Yeah, and I come from a medical family, and the trend over the last several decades has been increased socialization of medicine and moving basically doctors to a pay scale. Is that really what's behind this trend as well?
Yeah, well, that has always been the goal of the government, is really what they would like to see. They would like to put doctors on a salary instead of the fee-for-service basis, and they have been successful in some examples. They've managed to get doctors to move into groups by paying for their computer services, for example, in order to do that. So that, I think, is the goal. But of course, doctors consider themselves independent businessmen, really, or men and women, and they don't necessarily want to go onto that model.
No, but the problem is that the taxpayer, through the Liberal government, is on hook for any of the bills that come up. Is there any discussion of a two-tiered system in Ontario at this point, and is it something that would be acceptable across the country?
Well, clearly, Pat, that does make a lot of sense. Or to go back to the system of extra billing, where doctors who do have specialist services can bill more an ordinary doctor would do. I mean, I can remember when that was the way things were. You paid more for better doctors. It makes sense, but I don't think under the Liberal government there's any chance of that happening. They were the people. It was Eleanor Kaplan, you'll remember, who brought that in the Peterson years, and I can't see them backing away from that. But you have to look at our healthcare system. It is under stress every time you turn around. It is creaking under its own weight because it simply can't afford all the services. And yeah, I mean, why shouldn't doctors be able to charge a little bit more if they consider themselves better? Why not, let the market factors work in medicine?
Yeah. Well, the reason is pretty simple, because there's not a lot of flexibility for patients. It's hard for patients to even find a doctor these days because of this long-term approach to medicine being a social service.
Well, exactly. And if you look in the news release that Dr. Eric Hoskins came up with last week, what he was saying is that they are trying to hold the line on costs for those doctors already in the system. But what they are doing is using additional money to fund 700 additional physicians. Obviously, as baby boomer doctors start to retire, they've got to start bringing new doctors into the system. So they're trying to add more to that because, yes, we do have a shortage of doctors.
Yeah. Christina, thank you so much.